So if your back is hurting, should you even be deadlifting? It's a great question. And the answer, unfortunately, is, well, it sort of kind of depends, okay? The first thing with this example, if you're having what's known as referred pain, meaning that the pain is into your butt or down into your leg, no, you are not deadlifting. You should not be doing much exercise unless you've been evaluated by a skilled clinician to figure out what the heck's going on. Because if you're having pain that goes down the leg, even just into the butt a little bit, you're compressing a nerve. And you have to be very careful with it. It doesn't mean that you can't do things, but you need to know what's going on and what you can get away with. So if you're having nerve compression, I would say, generally speaking, this information is not for you. You need to go get evaluated by somebody who knows what they're doing. And listen, if you're local to EBM, I'm located in Danvers, Mass. Reach out to me, come on in for an evaluation. We can check things out and see what's going on. But the key is you want to be very careful with that, because it's very easy to make nerve stuff worse. So if you have pain going down the leg, then no, you should not be deadlifting. You should go get evaluated. Now, if you have pain that's kind of in the low back area, could be one side, could be both sides, could be kind of in that area, but generally speaking, it stays in that area, then we have something we can work with here. So if you look at pain on a pain scale, which is obviously very subjective, but 0 is I have no pain, and then 10 is the worst thing ever. And real quick, if you have 10 out of 10 pain, you cannot verbalize you have 10 out of 10 pain, okay? So if your pain is up there, you can't look at me with a calm face and say you're 10 out of 10 pain. That's not how that works, okay? If you're 10, you're screaming and you're in so much pain, you can't actually utter the fact that you're in 10 out of 10 pain. But if your pain is low, 3 to 4 out of 10, as far as what you perceive, and it's there, then okay, it's low enough so we could potentially look at deadlifting or doing some kind of a movement. Now the key though, and this is where how we sort of, with pain gets a little messy. It's not an all or none. It's not like if you have pain, don't do it. Because when you're rehabbing an injury, there is a certain amount of discomfort you're going to have to work through, but that's a very slippery slope. 3 to 4 out of 10 pain, so it's on the lower end. The pain cannot get worse. If it gets worse, you have to stop immediately. That's it, done. A lot of times, if you have some discomfort and you're doing a movement, but your pain just stays right where it is, then the movement that you're doing isn't directly irritating the problem, and it's relatively safe to do, okay? Big, huge gray area there, I get it, but that's something that I've used with a lot of clients and patients, because if you never have them do anything with discomfort, it's going to make it very difficult for them to progress. But you can't allow the pain to increase every time you do something, because that's directly irritating. You're basically poking the thing every single time. That's going to delay your healing. So the key is, if you can do the motion and the pain stays, great. Sometimes the pain will actually improve. It decreases as you get moving, which is a great sign. Okay, that means the movement is actually helping it get better, so that's great. So it sort of kind of depends. Now, we're going to talk about in the coming videos types of deadlifts and how to modify them. That's going to be really the key here, is you're going to have to modify what you're doing. And it might mean changing the variation. If you're doing a bar, go to the trap bar. If you're doing a trap bar, maybe go to kettlebells, and maybe elevate the deadlift. Not everybody is meant to pull from the floor. I know that sounds kind of crazy, but sometimes elevating your deadlift a little bit is a great way to take stress off your back, especially if there are hip mobility issues or other things going on. So the key really is find a way to make it easier, because what we're trying to do, oftentimes we need to minimize irritation to the back while we're kind of doing what we're doing. Usually we have to also work on some of the hip hinging technique things and the core stability stuff. So you're working on multiple things at the same time while you're trying to keep pain down. It doesn't make sense to just keep hammering the same type of deadlift you've always been doing, right? Make it a little bit easier. Elevate what you're doing, or go to a different version for a little while so that you don't have to be in pain. And that will also allow you to connect all the dots here, right? So then you have your core stability, your hip hinge, and your pain's going down, so you're reinforcing good movement patterns. It's very complicated, but that's the approach you really should be taking, is initially make it easier so that it doesn't hurt, work on your mechanics and tie all those things together, and then you can get back to doing the variation or the version that you were doing before when you had the pain, but when you get back to it, the pain should now be gone.